Hi, my name is Miriam Smetak. I'm a neurotologist here at UCI Health, and today we're talking about cochlear implants. One question I have is about the risks and side effects of cochlear implants and whether they're safe. So there are a number of risks with the surgery, as with any surgery. First risks we talk about are bleeding and infection. Anytime we make a cut in the skin, there's a small risk of bleeding. There are some big blood vessels that travel through the area, but generally bleeding is not a major concern for this surgery. We do worry about infection, and so we give you antibiotics during the surgery and sometimes even after the surgery to help prevent infection. I recommend patients that get a pneumonia vaccine prior to a cochlear implant because that helps prevent meningitis, which is a very serious illness after a cochlear implant. Very rare, but if it happens, it's very serious. The next things I talk about are there are a few important nerves that travel through the area, the most important one being the facial nerve, which controls the muscles of the face. We do monitor that nerve during surgery. We use electrodes in the muscles of the face. You may notice some poke holes in your face after surgery. That's from us monitoring that nerve to make sure that it's safe the whole time. There's also a nerve that controls some of the taste sensation to the tongue that travels right next to where we're working. That nerve is a little more sensitive and is often stretched or irritated by us working nearby. Sometimes you may notice a metallic or salty taste after surgery. Even if we have to cut that nerve, which very rarely we do, that taste sensation typically goes back to normal within a few months. Very rarely can have longer-term changes in taste. We are working on the inner ear, which means that dizziness is very common after surgery, generally settles down within a couple of days, rarely can have longer-term problems with dizziness or imbalance. If you have any residual hearing, then we do warn you about the risk of losing that residual hearing. And I tell patients it's about a 50-50 shot that I can save the hearing that you have in your ear. And that's part of why we wait until your hearing is bad enough that even if you lose what you have left, you'll do better with a cochlear implant. Those are kind of the major things. There are other rare risks with the surgery. The brain is right above the ear, so things like a spinal fluid leak or, like I mentioned, meningitis. But those are far, far less common. Cochlear implants are safe. We started implanting them in the 80s, and I am just now seeing those patients come back for a revision of their implant. So we expect this implant to last for 20 or 30 years for you. If you're someone who's younger, you may need one in the future. But for most of our patients, we hope that it's the only one that they'll need. Like any device, these can fail, and sometimes we do have to go in and revise them sooner than that. So if you have any questions about the surgery, if you're not sure if you want to go through with this, give us a call. We have neurotologists like myself who love answering questions about cochlear implants. So call us and we'll see you in the office.